Thank you, Mr. President. Mr. President, I come to the floor today having heard the majority leader open this morning's session by talking somewhat about the health care law, and he was referring to a headline that said that Republicans were going quiet on health care. He went on to then say that Obamacare is no longer very high on their radar screen. Well, Mr. President, I will tell you, as a doctor, someone who gets home every weekend to Wyoming, this issue of people's health care, something very important to them, continues high on my screen and high on the radar screen of Americans all across the country, because we're seeing all across the country that the president's promises have been broken. People can't keep what they had if they like it. Many are losing their doctor. There are many Obamacare side effects, and one doesn't have to go very far today to see on the front page of the New York Times this morning a comment referring in an article related to the president's promises. He said, if you like your doctor, you can keep your doctor. If you like your hospital, you can keep your hospital. But in this front page article, it says, the first paragraph, in the midst of all the turmoil in health care these days, one thing is becoming clear. No matter what kind of health plan consumers choose, they will find fewer doctors and hospitals in their network, or pay much more for the privilege of going to any provider they want. So the Senate Majority Leader may not want this to be a major issue in the minds of the American public, but it is, because their health care is so personal. Americans hate to see taxpayer dollars wasted, but they're seeing it all across the country. I note that article in Politico, $474 million for 4 failed Obamacare exchanges. Money completely wasted, taxpayer dollars. Didn't help patients needing care. The other day, The Hill, cover Oregon flops. FBI looking into Oregon's Obamacare rollout. There are huge problems with waste. Another article about problems in Colorado and problems with their exchange, and yet a story out today. What happened there with the exchange in Colorado? Outrage over a raise for Colorado Health Exchange CEO. So the impacts are felt all around the country, and it's just interesting, Mr. President, to hear the Senate Majority Leader make his comments at a time when his hometown area newspaper, the Las Vegas Review-Journal, has a headline story, May 4th, 2014, Own a Small Business? Brace for Obamacare Pain. Local business owners might be hoping the Affordable Care Act insurance mandate covers sticker shock. The law's employer coverage mandate doesn't take effect until 2015, but early plan renewals are starting to roll in, and for some businesses, the premium jumps are positively painful. So, Mr. President, I just come to the floor having heard the Majority Leader's comments. I'll have more to say about this later, as I see my colleague from the other side of the aisle has come to speak. But as one senator and a physician and someone intimately concerned about the care that the American public receives, their ability to get care, not empty coverage, but quality available care, this senator, in spite of what the Majority Leader may say, is not going quiet on health care, and it continues to be very high on my radar screen, as it is high on the radar screen of Americans who have been told many things by the President of the United States, many things that turned out not to be true. And these are why, week after week, I'm going to continue, Mr. President, coming to the floor to talk about the side effects of a health care law, which is hurting patients in terms of keeping their doctor, lower costs, they're seeing higher costs, not being able to keep their hospital, paychecks shrinking because of the health care law. So I appreciate the indulgence of my colleague from Oregon, and appreciate the opportunity to make reference to the Majority Leader's comments. Republicans, and certainly this senator, is not going quiet on health care. Thank you, Mr. President. I yield the floor.